Okay, greetings classmates. My name is Nate Jensen. I'm here on assignment for Gonzaga University. I'm a student, and today I will be interviewing Dr. Ken Cogswell. He's a psychologist here at the Spokane VA Medical Center. He's also co-training director for the psychology internship program. First off, I'd like to thank Dr. Cogswell for being my guinea pig and graciously accepting my offer to give us a general overview of your philosophy of leadership.
Happy to be here, Nate.
Thank you. So what is a general overview of your leadership philosophy?
Well, I think that it's important to model good behavior. For psychology interns who are just starting their careers in psychology, it's important to be on time, be professional, get your paperwork done on time, and to also, you're trying to teach them how to think about cases in a clinically effective way. So there's a fair amount of just explaining how I think about cases, kind of leadership by example in that way too. It's also important to model how you get along with other professionals, being willing to consult with them about their areas of expertise, not to pretend that I know everything, because I don't. So teaching people to be humble leaders while also being assertive and not afraid to ask questions.
Good. So what I'm understanding is, especially because you're a leader for young learners and students, is that leading by example, being a good model for them, is the main points of your philosophy?
I think so. I think people always, especially psychology graduate students, are watching their supervisors to see how they handle themselves in a variety of situations, not just clinically, but also interprofessionally. In terms of self-care, that's something we talk about in our program as well, because we want people to learn how to get their jobs done in 40 hours a week and then take care of themselves so they don't burn out.
Right, exactly. Good, good. So if you don't mind, I have a few quick questions for you.
Sure.
Who or what has influenced the growth of your leadership philosophy the most?
I had some good professors in graduate school who were very effective therapists, but also good teachers of how to be a good therapist and a psychologist. So Dr. Phil Bornstein was one person that I think I looked up to, as well as Dr. Al Walters, who was kind of head of our clinic on campus. I have a friend who's been an administrator and a clinical leader at the place I first worked in Bakersfield, California. He's taught me some because he's been the director of a clinical psychology internship program for about 15 years.
Oh.
So he was also a good model. And I think my boss here at the VA, Dr. Quinn Bastian, has also been a good model for how to lead people. I don't always agree with his style, but most of it I do. And he's a good leader that I've observed for the 8 years he's been here.
Good. Yet, being in a leadership program, I am noticing that I'm latching on to strong leaders in my place of employment as models, because I think that's the best way to learn, is to look at good examples. Good. So next question, should leaders have certain qualities to be able to lead?
Well, I think there's a variety of ways to lead. You can't act and do it. You can certainly learn how to be, say, more assertive if that's something you're have a deficit in. I think good leaders are always good listeners, because people, if you're leading, people, they're going to be different, and you have to make them feel heard and understood. I think to be a good leader, I do think you have to be decisive. How much so kind of depends on the role you're in, but That doesn't mean acting impulsively or always quickly, but when you do act, you explain your rationale and say, this is what we're going to do and why. I think in leading people, that's a little more important. As a clinician, it's okay to be more curious because there's lots of ways to be a good clinician. But still, and I guess part of being a good clinician for me and teaching people is helping people grow into the kind of clinician they will be. So giving them a certain amount of independence along with, making sure they're doing their job is kind of how it works. And we follow kind of a developmental model. So at the beginning of the year, you watch people a little more closely and make, reminders. Then as the year goes along, hopefully they need less of that.
Right. Okay.
But you do have to take people where they are.
Yes.
And not every intern comes in at the same level.
Right. That's good to know. Last question. Since this is a communication class, what are your opinions on how a successful leader should communicate?
Well, I think some degree of self-disclosure is important. Feeling comfortable with talking about your past, how you arrived at this spot, mistakes you've made as well as successes that you've had. I think that invites people to be a little more open and honest with you. And I think being as transparent as you can be. That doesn't mean you tell everybody everything, but being genuine and transparent is important because people, they will know if you're not.
Right. Yes.
So I think doing that in a way that still maintains your professionality and protects boundaries if you need to do that. As a psychologist, that's an important skill.
Yes.
But being as open as possible and giving feedback to people that is constructive, emphasizing the positives as well as areas in need of growth. So hitting both of those, I think, helps people feel comfortable, learn to be open with you, and encourages them to grow.
Perfect. That's kind of the answer I was hoping for. Right now in the class, we're reading Critical Conversations book, and that's pretty much what a critical conversation entails, is being transparent and open and offering feedback. And when I'm reading this book and hearing the examples, some of the examples, I consider you a very good communicator, and I envision you and your communication styles, and that's something that I want to work towards. So well done, and thank you very much for this interview. That was all the questions I had. Did you have any questions for me?
Just one final comment is I've certainly, since I've been the co-training director, I've learned more about how to be a good supervisor and leader. Those things are complementary, not exactly the same.
Right.
But it's definitely been a learning experience. I've learned from my interns, from my co-training director, from other leaders in the VA, which is nice because in the VA it's easy to be on mail groups or have conferences where you're learning from other people's examples, mistakes, experiences. So never stop learning.
Yes, that's good advice. Thank you. And I'd like to thank you one final time for agreeing to do this, and I'd also like to offer my classmates to critique this video and provide me some feedback. Thanks again.
You're very welcome, Nate.
Thanks. Bye.